Hello and welcome to our channel. As a care worker, communicating effectively with patients is crucial. In this video, we'll explore do's and don'ts and what to say and what not to say to patients in English. Let's get started. Section 1. Do's. Do. Introduce yourself and address patients by their preferred name. Use simple language. Avoid using complex words or sentences that might be hard for patients to understand. Show empathy and understanding. I can imagine how difficult this must be for you. Respect patients' privacy and dignity. What would you like to do today? Or, how can I support you in making this decision? Offer choices. Do you prefer to take your medication now or after breakfast? Explain the purpose of tasks. I need to take your temperature to make sure you don't have an infection. Listen actively and respond appropriately. I'm in pain. I'm so sorry. Let me get you some medication to help with that. Be patient and calm. Speak in a gentle tone and move at a pace that's comfortable for the patient. Section 2. Don't. You must not talk down to patients. Thus, avoid using a condescending tone or speaking in a way that's patronizing. Avoid assumptions about patients' backgrounds. Thus, don't assume someone's culture, beliefs, or values based on their appearance or name. Try not to use sarcasm or humor that might be offensive. Avoid making jokes or using sarcasm that could be misunderstood. Do not criticize or blame patients. Rather, focus on supporting patients, rather than criticizing their choices or actions. Avoid taking things personally. Just keep professional, and avoid taking patients' emotions or behaviors personally. Do not gossip or share personal information. You do this by maintaining confidentiality and respecting your patient's privacy. Try not to physically touch your patient without their consent. You must always ask before touching or handling a patient. By so doing, you will be respecting their boundaries. Do not ignore your patient's concerns or questions. Try by all means not to interrupt or talk over your patients. Give them time to talk and listen to them more. Do not make assumptions about patients' needs or feelings, or even share personal opinions or biases. Section 3. What to say. Here are more examples of what to say. Ask open-ended questions. What's been the hardest part of your day? Or, how are you feeling about your treatment? Or, hello, how are you feeling today? Or, can I help you with anything? Use positive language. You're doing a great job. Or, I'm so proud of your progress. Offer reassurance. You're safe now. Or, I'm here to support you. Explain what you're doing. I'm going to take your blood pressure now. Or, I need to give you this medication to help with your pain. Or, let me explain this procedure in a way that's easy to understand. Ask about preferences. Do you prefer to have the TV on or off? Or, what kind of music would you like to listen to? Show interest in patients' lives. What did you do before you came here? Or, do you have any pets? Use empathetic statements. That sounds really tough. Or, I can imagine how scary this must be for you. Section 4. What not to say. And here are some examples of what not to say. Avoid making promises you can't keep. Don't say, "I'll be here all day," if you know you have to leave soon. Don't minimize your patient's feelings. Avoid saying, "It's not that bad," "You're fine," or "Don't worry," or "You're overreacting." Avoid giving unsolicited advice. Don't say, "You should," or "You need to," without being asked for advice. Don't talk about yourself too much. While it's important to build rapport, avoid dominating the conversation with your own stories. Avoid using jargon or technical terms. Use simple language that patients can understand. Don't say, "I know how you feel." While you might be trying to show empathy, this statement can come across as insensitive. Avoid making judgments or criticisms. Focus on supporting patients rather than criticizing their choices or actions. I don't have time for that. That's it for today's video. Remember, effective communication is key in care work. By following these do's and don'ts, what to and what not to say guidelines, you can provide better care and support to your patients. Thanks for watching. Please do not forget to like, share, and subscribe to our channel for more helpful content. See you in the next video. Bye.